Now, may I take an honor to invite Dr. Madhuri Samudrala for her lecture on HIFU. She is the Managing Director of Amma Hospital, Yeleswaram. She is a Managing Director of Institute of Feminine Aesthetic, Rajamundry. She worked extensively on menopause and functional gynecology, on SUI and GSM. Ma'am, please welcome.
Close it. Close it. This one. Good afternoon, everyone. Thank you very much, IMS organizers, for giving me this opportunity. It's a great honor for me to speak in front of my mentors like Dr. Jamana ma'am, Dr. Ragini Agarwal ma'am. Thank you very much. So I'm going to talk about HIFU in vulvovaginal rejuvenation. So why vulvovaginal rejuvenation? Like over time, age-related events such as hormonal changes, pregnancy, childbirth, and menopause can affect the internal and external structure of the vagina and vulva, causing changes both in its appearance and physical response to stimulus. Like, as we can see, when it comes to vulvovaginal rejuvenation, many people nowadays come to us, like those who are getting married, they come with labia minora hypertrophy and hyperpigmentation of the labia. Like, how many of you get these cases? Please raise your hands. So many of them say that, ma'am, I'm worried about this stretching skin. My husband may think like, I heard that these labia stretch only after childbirth. So I have it now, my husband will feel otherwise, so I want a surgery. So it is our duty to explain them. So these about the estrogen receptors, if you chop off the labia, all the sensations will be lost. So you can use, if it is grade 1, grade 2, you can use energy-based devices. You can use peels for hyperpigmentation. And postpartum, be it a delivery or a cesarean section, the vaginal caliber, ligaments, and the retaining ligaments, the turgidity doesn't go back 100% normal because of the hormone relaxin, which is present throughout pregnancy. The ligaments and the vaginal cavity is stretched. So they need vulvovaginal rejuvenation in the postpartum. And in obesity, the blood supply is less, and we see many patients coming with stress urinary incontinence and patients with chronic cough. Like, they think it is normal to leak 1 drop of urine when they sneeze and cough. So they don't even complain. And then perimenopause and menopause, you see patients with stress again, dysuria, burning sensation, vulval dryness. So you think all these problems are new ones? All these problems have been there since ages. The treatment modalities have changed, and it is our duty to create awareness in our patients that such treatment modalities are available. And don't promise them like magic, like come, you'll get rid of this and all. So you have to offer them treatments. These are the latest treatments. Let us try it on you. That's all. So don't promise them magic treatments, miracle treatments and all. So we all have to train, and like Jamana ma'am's dream is like every gynecologist an aesthetic gynecologist. So we all have to train, and we all have to address these problems. So what does HIFU stand for? HIFU stands for High Intensity Focused Ultrasound, which focuses the ultrasound waves to create heat at a specific point. This is called the focal point where the heat effectively destroys the targeted tissue. So HIFU is a non-invasive therapy that uses ultrasound waves to thermally ablate a portion of tissue, meaning the tissue is destroyed using intense heat. It was first invented to treat cancer cases. Even now, HIFU is used for prostate cancer. It is the treatment of choice for prostate cancer. So we'll not go much into the history. I have only 8 minutes and I have to sprint through. So the mechanism of HIFU takes in two forms: the conversion of mechanical energy into heat. Heat causes the tissue to heat up and destroy the cells. So we were speaking about heat, like someone was saying this doesn't work, that doesn't work. So every energy-based device works. You have to know, like, until what level, for what indication, what device works. So you have to, like today I'm able to speak, like I worked with more than 10,000 procedures, and most of them, most of my studies were on CO2 fractional laser. Like I used to run an old age clinic from the past, I run an old age clinic from the free clinic from the past 15 years. So most of them are these cases only, like dysuria, severe burning sensation, and urgency, frequency. So I worked, and like CO2 laser is a blessing for them. And PRP injections for the cheaper, like no, all the people can't afford, right? So we can offer PRP, and people can afford, we can do fillers. So according to the patient's pocket, we can plan. And don't do charity like me and get broke. And coming to mechanical cavitation of pressure waves in the tissues, it causes tissues to vibrate and mechanically stress the cells, causing them to die. Like I also practice facial and body aesthetics. So there we use HIFU for tummy reduction. So it's a device designed to produce small microthermal zones of coagulation in the middle, deepest, and the dermis and the subdermis. So this is how it works: the inflammatory phase, proliferative phase, remodeling phase. The difference between HIFU and HIFM are they are low intensity waves, more frequent, they converge. The ultrasound we do, it's divergent and it's diagnostic. So these are the three cartridges we use. The depth is 1.53 mm and 4.5 mm. Of all the devices, HIFU is my favorite because it is a triple layer lifting system. It works on the superficial, middle, and the deeper layers. So this is how it works. I'll show you a short video. Or otherwise, and we can use labia for labial remodeling also for the menopausal syndrome, vaginal dryness. And the efficacy is assessed by ICIQI, FSFI, vaginal laxity score, vaginal pH strip. I suggest each and every one of you keep a vaginal strip in your OPD. You can just put a strip in the vagina and color compare. You know the vagina is alkaline. That's the easiest thing you can do. So with HIFU, studies have shown that 20 to 23% increase in collagen after 4 weeks. So it's effective for vaginal laxity, dryness, relief from vaginal queefing, early grade SUI, and pelvic organ prolapse, improved mucosal resistance to infection. So until now, I have worked on 36 patients of first degree and second degree vaginal prolapse. And it is not the end. They come for my training sessions once in 4 months, 6 months to get their top-up session done for free. And talking about mucosal resistance and infection, so with collagen stimulation, the superficial squamous cells, they start shedding, which in turn increase the glycogen levels, and they increase the lactic acid bacillar levels, and it gives protection from recurrent white discharge. So all of the energy waste devices work for recurrent white discharge. So in my area, I come from a place called Rajahmundry in Andhra Pradesh. Recurrent white discharge is an indication for hysterectomy in our place. So these are coffee break procedures, and this I wanted to show, like many people were saying this works, that works. We all have to know this. So as you can see, look at the temperature column. So the body temperature is 35 degrees centigrade. And you can see the green, yellow is suboptimal. Yellow is 60 degrees. Collagen denaturation is the orange color. And ablation is the red. Okay? Then coming to lasers, a fractional laser, the temperature is 100 degrees centigrade. And lasers are very, very superficial. Like erbium is 0.3 microns. CO2 is 1.5. It is precise, it is fractional. So it's all in how you train. So if you train well, there are no burns. People are scared that lasers may burn, but they are very, very safe as they're superficial. All you need is a proper training. And what you do with a fractional laser is resurfacing. You're regenerating new tissue. Coming to radio frequency is again 3 mm depth and it is bulk heating. The effect is immediate. Radio frequency, like it is very good for sexual gratification, and when we work on the face, the wrinkles and fine lines are immediate. Even the crow's feet, they vanish like anything, radio frequency. So the effects are not long lasting with RF. Coming to HIFU, so it works on the 3 layers. As you can see, like some people feel HIFU burns because they think it is the HIFU which they use for ablating. It is not ablative HIFU. This is precise, this is fractional. So it works on 3 layers, as you can see. The deepest layer is 4.5, it works on the SMAS layer. So it is, the effect is, it takes a couple of days, but the long lasting. So the complications you all know. So it is deep, so it can be combined with any device. And these are the results, before and after pictures. These are my own pictures. As you can see, with one single treatment, all the wrinkles are vanished. See this for vaginal tightening. This is one session. This is a combination with CO2. This is a filler. These are my testimonials of my patients. And you can't avoid age, you can't avoid death, but you can choose to be functional as long as you live. Thank you. Ma'am, one thing I want to tell you is, there is, with all due respects to Ragini ma'am, we shifted from cosmetic to FRAG. We call it Functional, Regenerative and Aesthetic Gynecology, FRAG clinics now. Recent studies, they state that this regeneration is not going to change the architecture forever. So we are going to call this as biostimulatory medicine in the future. Whatever it is, it could be energy-based devices or injectables. It's not forever. We have to rejuvenate again. So it is biostimulation. Yeah. So we are not supposed to call it regenerative also nowadays. Initially we do 3 sessions. You can't stop aging, ma'am. So we keep on aging. So we need to stimulate the collagen. So in youngsters, the vaginal epithelium sheds every 15 days. In reproductive age group, 30 days. In menopause, more than 45 days. So you need to stimulate. Thank you all.
Thank you, Dr. Madhuri.